Thank you, Mr. Speaker and members. This is the Health and Human Services Bill, the omnibus bill, together with the state government bill and public safety. There are several provisions within this bill. This is a supplemental bill. You should know that our fiscal target for this is 0 in the general fund and 0 in the healthcare access fund, which complies with that. We have $11.4 million in the general fund and $7.175 in the healthcare access fund, which are deployed within this bill, and they are spent with savings from other portions of the bill. So there's 0 net spending for both the general fund as well as the healthcare access fund. There's several pieces to this bill which are important. I think the first piece within our healthcare programs, and the most substantive and largest difference from the Senate and the governor's requests, dealing with MNsure. This is eliminating MNsure as we currently know it, and also trying to help those middle-class Minnesotans who are affected by this, not just who are on our programs, but also those struggling to pay health insurance premiums and are unable to do so because their rates are being inflated so much by our disruption within the current finance structure that we have. I want to just call out Representative Rarick for his work in the MA liens. A lot of people, probably every member of the legislature has heard from your constituents who are age 55 to 65 who have been put on Medicaid, and maybe you own a house or a farm and they've had liens placed against them. They didn't know they were going to have these liens. They didn't even know they were going to be put onto Medicaid. They can't get off. They find out from the government that they have a lien against their house or their property. That addresses this. They should never have been put on those programs without being warned, and most of those folks probably wanted to be on another plan. This allows them to take those liens off of their home. So I want to Representative Rarick, I want to recognize him for that. We also moved to a federal exchange within this bill, puts us in line with other states that we're currently sort of paying the price for MNsure and all of the costs associated with it, all of the harm associated with that, but we're not really seeing the benefits from that. Puts us on par with other states that will allow us to benefit from that. Representatives Zerwas has a federal waiver to decline Minnesota Care and obtain APTCs. We also have Representative Zerwas carrying other MNsure reform measures. We require currently, and the savings from the bill is derived in this way, currently the MNsure is taxing our policies at 3.5%. That's where the money that MNsure makes comes from, but it's also helping itself to our general fund and our healthcare access fund, using that as an overdraft account. This bill takes that money back and redeploys it in another way, and it also sets up a firewall so that future agencies can't just simply exchange checks with invoices to rewrite a budget passed by the legislature. So it affirms the legislature's ability and requirement and responsibility to set a budget and keep it. Representative Keel provides funding for a demonstration project for certified community behavioral health clinics. It's really a great step forward from some work that we did last year in mental health. Representative Baker, funding for children's mental health collaboratives. Representative Peterson, Zumboro Valley Health Center. Representative Halverson, peer specialist funding, also within this bill, within the area of mental health, which I'm very proud of the work that folks on the committee and in other committees have done to really chip in on that. Representative Franzen's child care, affordable child care bill is included within this. It's a great step forward for child care. We really did benefit from the work of Representative Schumacher's committee in aging and long-term care. Several of those provisions are contained within this, as is several provisions by Chair Mack and her policy committee. I do appreciate that. Members, we have a great deal of work, and I just want to leave it with this, with one optimistic, forward-looking piece. From last year, one of the things that we really wanted to do as a caucus and we're really committed to was a 5% campaign for home and community-based services and the people who work with the disabled and the challenged at home, being able to keep people in the community. Those folks are underpaid and they need a raise. Representative Drazkowski worked very tirelessly last term to try to get at some of the money that is being wasted. And I think that there was some scrutiny about Representative Drazkowski's bill on the floor about whether that money is really there or whether it's just pixie dust. What the legislative auditor found out was that there's a 95% chance that over a 5-month period between $111 and $270 million was wasted by spending that money on programs that people didn't qualify for. So what Representative Drazkowski's bill is now doing is taking from the greedy and giving to the needy within a deployment bill that really focuses on the 5%, contains it, and deploys whatever funds we have. And if there's no money there, there won't be any deployment. But Representative Drazkowski thinks that there's $1 million a day that's available, and I agree with him, and I think that that estimate is maybe even light. So that's moving forward, an optimistic thing that we didn't get done last time that we wish we would have done better by the people who provide home and community-based services. That's a little bit about what the bill does. There's more bills in it than that. I'm sure we'll sketch around the edges of those as the amendments come up when the Democrats offer their amendments and their priorities of what they would like to do or what they would have done with the same opportunity, and we would look forward to that debate.